Thank you, Rick. Yeah, I thought it was a great session this morning with some very interesting speakers. A lot of politics around healthcare reform. It reminds me of a story, a true story involving politics. It seems around the beginning of the century, a senator from Illinois by the name of Senator Depew had the distinct honor of introducing President Taft at a prominent political function. Now, Senator Depew considered himself a fairly accomplished orator and went on entirely too long, waxed and waned, talked about the many accomplishments of President Taft, the fact that he was the first ambassador to the Philippines. In his excitement, he said the president is pregnant with liberty and pregnant with justice. Well, if you remember your history, President Taft was a rather large individual. Well, he finally got up to the stage, took to the podium, put his arms around his great circumference and said, well, if this is a boy, I'm going to name him Justice. If this is a girl, I'm going to name her Liberty. But if all this is just gas, I'm going to name it Depew. So let's talk about the Affordable Care Act a little bit. Well, clearly the passage of the act was anything but bipartisan. In fact, the Affordable Care Act, or its repeal, became the mantra of the Republican Party during the race for the presidency in 2012. It was, and to some extent continues to be, the single most important domestic issue which divides our country. And to date, certain aspects of the Affordable Care Act that we discussed this morning have been enacted. But these provisions have been primarily focused on insurance reform, such as restructuring or restricting the ability to deny coverage for pre-existing conditions, the creation of transitional rebates to help seniors with the so-called donut hole for prescription drug benefits, and the ability to keep young adults on their parents' insurance policy until the age of 26. These and other insurance reforms that have been enacted, for the most part, have been non-controversial. However, many of the provisions of the Act that will become effective in 2014 have been quite controversial, as we've heard this morning, and have served as good political fodder during the past 18 months. So let's take a look and go back in history to figure out why we're even having this discussion today and how did we get into this situation. To understand this, we actually have to go back almost 75 years. So let's refresh our memories on how we arrived at our present day situation. Our healthcare system in the United States is a result of several major policy decisions rather than just one unified healthcare policy. We have employer-based coverage, government-sponsored coverage, and EMTALA. Now, prior to World War II, healthcare didn't cost much because we didn't have much in the way of technology or medication. During the war, America imposed wage controls to prevent runaway inflation. There was a shortage of workers, so employers were encouraged to compete for workers by offering benefits such as health insurance. Now, after the war, after the devastated European nations were rebuilding their infrastructure, they had little choice but to build their healthcare systems through their government. America, meanwhile, maintained its employer-based system. Now, in the 60s, Congress realized that there were limitations to the employer-based health insurance model because some people don't work. The result was the enactment, as we heard much about today, Medicare, which is a federally funded program to cover the elderly, and Medicaid, which is jointly funded by the federal and state government to help cover the poor. America still had a draft in the 60s, so most American men were required to serve in the military and therefore were entitled to VA benefits for life. So Medicaid was designed to cover women and children only. Now that we've had a voluntary army for years, millions of adult men find themselves without insurance coverage, even if they have full-time jobs, because they're not eligible for VA benefits. So today in the United States, 52% of the population is covered through their employer, 28% via the government, 5% have individual policies, and 15% of the population is uninsured, which represents about 50 million people in the United States. Now, in the 80s, through EMTALA, which is the Emergency Medical Treatment and Active Labor Act, under the Reagan administration, Congress decided to address the problem of the uninsured by requiring hospitals to treat every person who presents to the emergency room, even if that person can pay nothing. this requirement in America, even if they're here illegally. Now, there have been several other attempts since the 80s to deal with healthcare reform. In the 90s, attempt for a government-centric reform proposed by President Bill Clinton, known as Hillary Care. And again, in the 90s, Bob Dole and his fellow Republicans argued for a market-based system designed around an individual mandate with the creation of state exchanges. Sounds pretty familiar. And in 2006, under President Bush, we expanded Medicare to cover prescription drug benefits. This brings us to the current state of affairs, where in 2010, President Obama signed into law the Affordable Care Act. The policy decisions that I have just discussed that have occurred over the past half century have left a significant gap in coverage in the United States as well as in the state of Florida. In Florida, 7.7 million of our citizens have employer-based health insurance. 6 million rely on government-sponsored programs for coverage, again, Medicare, Medicaid, VA. 920,000 have coverage that is purchased in the free market through private plans, and almost 4 million of Floridians have no insurance at all. So let's take a look at who are these uninsured. I think it's easy for us to characterize these folks as folks that are either drug addicts or not willing to work, but in reality, that is not the majority of the individuals that are uninsured. The majority are low-income working families. 38% of the uninsured are at or below the poverty level, which is for a family of four, $23,000 a year in annual income. 90% are in low or moderate. 90% are in low or moderate income families, meaning they are at or below the 400% of the federal poverty level. And over 60% have at least one full-time worker in the family, and additional 16% have a part-time worker. Most of these workers are either self-employed or work for small companies where benefits are not offered, or they cannot afford benefits with the wages that they are earning. You know, children are the least likely to be uninsured because they are more likely to qualify for Medicaid. So just to get us all on the same page, and this was discussed quite a bit this morning, is that the controversial aspects, which we'll talk about with the next speakers, is that by 2014, states, and it says must, that was the original language, may extend Medicaid, as we had a significant discussion this morning, eligibility to all legal residents up to 133% of the poverty level and under the age of 65 years old. Now, 133% of the federal poverty level is $14,000 for an individual or $29,000 for a family of four. The federal government will agree to cover 100% of the state's costs from 2014 to 2016 in the following proportions thereafter, and you can see that stepping down to 93% in 2019. The debate as to whether the federal government will meet its obligations is a different issue. There's also additional insurance reforms, no annual limits on coverage, no denial of coverage for adults with pre-existing conditions, no higher premium based on gender or medical history. Insurers required to report their share of premium income spent on medical care, and it limits the amount of out-of-pocket costs beginning in 2014. Obviously, the individual mandate is extremely controversial. Beginning January 2014, all U.S. citizens and legal immigrants must have coverage or pay for a penalty when they file their federal tax returns. And you can see the amount of penalties there stepping up from $95 in 2014 to $695 in 2016, or percent of the household income up to 2.5% in 2016. And then pay or play for larger employers that's greater than 50 that do not offer coverage would pay a $2,000 per year per worker penalty minus the first 30 full-time employees. And the employers with fewer than 50 employees would be exempt. So those are the issues that are the controversial, the issues that are creating a tremendous debate, not only here in Florida, but in Washington. My colleagues now talk a little bit about how it's impacting our organizations here locally.